Why do some people suddenly start to feel unsteady or feel like the ground is shifting beneath them? You might be surprised where the answer lies. Feeling a little wobbly when you walk? Or maybe you're avoiding stairs or uneven ground because you just don't trust your footing anymore? These are more than just normal signs of aging. They're a warning sign that your balance system may be breaking down. But the good news is that you can do something about it. Falls are one of the most common and serious causes of disability, especially among older adults. Over 30% of people over the age 65 fall every year, and in about half of those cases, it happens again and again. Stick with me and I'll show you how to rebuild your stability from the ground up using safe, natural methods. Now let's take a quick look at what's going on inside your body when your balance starts to fail. The first is the inner ear balance system. This is the primary balance system in your body and it's located in your inner ear. It's called the vestibular system, or simply the inner ear balance system. It's made up of fluid-filled tubes that work much like a carpenter's level. When this system is working properly, it sends clear signals to your brain to help orient your body in space. But when those signals become slow, disrupted, or irregular, your brain can struggle to figure out where your body is in space. And it might look like this. Here you are with a good inner ear function, you're balanced. And over here where the inner ear function is less than optimal, you have trouble orienting yourself in space and you feel wobbly. Muscle strength is another important element for maintaining balance. Strong muscles help your body stay upright, recover from stumbles, and reduce the risk and severity of falls. Strong muscles depend on the proper nerve flow to and from the brain. Poor nerve flow between the brain and the muscles leads to weakness, instability, slower reactions, and a greater risk of falls. And it's easy to see somebody who's at risk for this type of problem. Here's a person with normal muscle strength. You can see as they walk, they have a nice, upright, confident posture. Over here, we see this person. They're bent over. Their head is forward of their center line, and they are definitely at high risk for a fall. The next element is foot position and joint position sensors. Your joints and the bottoms of feet have special nerve sensors that detect pressure and joint position and relay this information to control centers in your brain. When these sensors are working well, you feel stable and confident as you move. When these sensors are not working well, your brain begins to get incomplete information and you feel unstable, unconfident, and have difficulty keeping your body balanced and upright. And you can see it very easily in an individual. It might look like this. Here we see somebody with good joint sensors. They're not afraid to move around, dance, lift things, climb. And here we see another one with poor joint sensors. He needs a cane for stability, sometimes a walker. Again, he has the slumped forward head posture like this. His gait is steady and sure. His gait is shuffling and unsteady. The fourth element relating to loss of balance and falls is what we call polypharmacy. Polypharmacy is defined as the simultaneous use of multiple drugs for one or more conditions and is a recognized risk factor for falls. The more drugs used, the greater the risk of side effects, harmful drug interactions, and falls. A brain not impeded by drugs processes information with clear signals. A brain impeded by drug use can have trouble processing information and sending and receiving signals. Over here, here's a person living a drug-free life or a minimal drug life. And over here is a person whose body has succumbed and they are now taking multiple drugs. You can tell if somebody's at risk for this simply by looking in their medicine cabinet or seeing how many drug or medicine bottles they have. When any of these systems, the inner ear balance, muscle strength, joint sensors, and brain processing power begin to break down, the brain receives mixed or incomplete messages. Your risk of falling doubles with each additional risk factor. It starts around 8% with maybe no risk factors and can rise to as much as 70 or 80% if you have all four. Mild strength training, walking, balance training, and working with your doctor to reduce the amount of medications you are taking are important steps to improve balance. However, in the next few minutes, I'll reveal to you the common factor to all of these issues and how to address it and improve balance and reduce your risk of falls with one simple routine. Now, if you need one-on-one advice, text me through my contact page. I've put a link in the description below. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm an expert in Western acupuncture. I've dedicated my life to helping people avoid unnecessary medications and surgeries by giving them options that are both safe and effective. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos like this come out. The common denominator to all problems related to loss of balance is poor nerve flow. Whether it's nerve flow between your brain and your inner ear, between your brain and your muscles, between your brain and your joint senses, or within the brain itself, nerve flow is fundamental to good balance, and poor nerve flow causes problems with balance. I'm now going to show you key acupressure points that are known to improve nerve flow in your body. The first powerful point to improve nerve flow and balance is located on the inside of your leg. To find this point, start with the tip of your ankle bone, right over here. Then find the point that's the width of 4 fingers above that, right here. Push in to find a point that is sensitive, sore, tender, or painful. That is the point. Massage this point in a circular motion for 20 to 30 seconds, like this. Or if you have a Shin, which is a spring-loaded acupressure instrument, you can pulse it 25 times, like this. Now find and activate this point on your other leg. The next important point for improving nerve flow and balance is located on the inside of your arm, just at the elbow joint. To find this point, start at the tip of your elbow over here, then move up towards your elbow crease. You'll be going over a bone, and when you come off that bone, you'll be in a soft area. Push in to find a point that is sensitive, sore, tender, or painful. This can be quite tender in some people. Massage this point in a circular motion for 20 to 30 seconds, like this. Or if you have a Shin, pulse it 25 times, like this. The next point to massively improve nerve flow and balance in your body is located at the top of your head. To find this point, start at the tips of your ears, then come up till your hands meet right here at the top of your head, right over here. Now push in to find a point that is sensitive, sore, tender, or painful. There might be a slight depression there. Massage this point in a circular motion for 20 to 30 seconds, like this. Or if you have a Shin, you can pulse it 25 times, like this. The next step to improve balance is to promote deep healing. I've put my video, Unlocking the Power of the Vagus Nerve, right over here. Have a look.